Welcome back to the Armchair Meddler, where I review news videos, usually of a sensational nature, and I give you my opinion, even though you didn't ask for my opinion. That's what makes me the Armchair Meddler. So today we're going to take a look at a man who has monkeypox. And apparently he is the first person in the U.S. to make his diagnosis public. And he says he wanted to get the information out there. So let's not delay any further. Let's get right into this video.
Monkeypox patient to go public. Matt Ford lives in Los Angeles. He's sharing his symptoms with brutal honesty. Fox 11's Gina Silva spoke with him tonight. She's live for us in Sherman Oaks. Gina.
Well, Alex, Matt Ford was frustrated with the lack of education on this virus. So when he got sick with monkeypox, he decided to share it with the world.
So my name's Matt. I have monkeypox. This sucks and you don't want it.
When Matt Ford of Los Angeles was diagnosed with monkeypox, he posted a warning on TikTok that immediately went viral.
I've got these on my arms and hands that you can see. They are really not cute.
Okay, so first of all, I do want to commend this man for coming forward with his diagnosis and bringing about public awareness to it. So let's see if hopefully they share some more information as to how it can be prevented.
Private matter and made it public. Were you concerned how people would react?
At a certain point, I just thought people are going to say what they're going to say. I really want to get this out there. So I just hit publish and let it fly. And the rest was history.
While there were some trolls, Matt says most people were kind and wanted to know what he was going through.
The first week was more flu-like symptoms, fever, cough, sore throat, full body chills, and night sweats. And as those symptoms kind of abated, more and more lesions started to appear. And some of them in more sensitive areas on more sensitive skin were at worst excruciatingly painful.
Nationwide, the CDC has confirmed more than 500 cases of monkeypox. In California, 111 cases. Monkeypox is spread through intimate skin contact and sexual intercourse. The cases have been disproportionately reported among men.
We're telling people, that you need to be careful of those things. Protection is the best way to go when it comes to taking care of yourself.
Jose Arballo is the public information officer for the Riverside County Health Department, which just reported its very first case of monkeypox.
We haven't seen the...
Okay, so I just want to comment on the fact that he said protection is the way to go, but he doesn't elaborate. Okay, so my thoughts is that when he says protection, it sounds like he's talking about condoms. That's my suspicion. But yeah, I could be wrong, but it does sound like condoms to me. Let's continue.
Cases like we have in other areas, other regions like LA County, but we're expecting that it's possible that it could be more in the coming weeks and months.
I think we don't know how many there are. I think a lot more people have it than the CDC is currently reporting due to lags in testing.
Jose Arballo.
Okay, so something that they did say earlier in the video, they did mention that the cases are mostly men. So the cases being mostly men, are they didn't say it, but is it perhaps same-sex relations that's going on? Because they did say that's sexually transmitted. So that's a question I have. Is it mostly being transmitted through same-sex relations? Let's continue.
Works in public health admits more education is needed, but he says
we're doing all we can to educate, like I said, the public and public health medical providers to give them as much education as possible about monkeypox and how to slow the spread.
It's taken 3 weeks for Matt to recover. He says,
okay, so I want to say that I am happy that this man, that he has recovered from it. I'm glad that he's doing well. I don't know why they aren't reporting, or he didn't disclose, at least in this interview, how exactly did he contract it. It doesn't seem to go into that.
He wants people to take away from his story is this.
To anyone who is exposed, or especially who comes down with this, there is no reason to feel any shame or stigma. You've done nothing wrong. This is just how the cards fell. But see your doctor, isolate, get vaccinated early on if you can, even if you've been exposed.
Now, the thing is, vaccines for monkeypox are not readily available. The supply is extremely limited. For example, in Riverside County, they're only providing vaccines for people who've actually been exposed. Now, that could change in the future, but that's just the way it is right now. Alex, Christine, I'll send it back to you guys in the studio.
So it sounds like there's not a lot you can do to prevent it.
Okay, so I'm going to just stop it right there because the newscaster in the studio just said, sounds like there's not a whole lot you can do to prevent it. But to me, since they did say that it is transmitted through physical contact and they said sexual intercourse, don't sleep around. If you don't sleep around, that will decrease your chances of contracting this disease. Let's continue. Or virus.
No. Just be very careful as our bio said, protection.
Okay, there's the word protection. Why not just say condoms? Okay, either condoms or just don't sleep around.
All right, Gina, thank you.
Okay, so that's going to wrap up this episode of the Armchair Meddler. I hope you enjoyed watching. If you can, please press the like button. If you aren't subscribed, please subscribe. Make sure your notification bell is on because more videos are coming soon. Peace.